great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
Hey guys, welcome to the broadcast. Phone number is 888-659-3727. I always start off saying it's great to be here. It's not terrible being here.
It doesn't suck.
It doesn't suck. It's not such a bad kind of Friday late afternoon gig.
Yeah. Could be worse.
Yeah.
Could be a job.
Yeah. I really don't mind it.
No.
Except I'm getting so much shit for, I put up a reel on Instagram, just me in my robe. People seem to dig the robe, and talking about finasteride, and people ask me if it's anti-aging, whatever it is. Mm-hmm. And all of a sudden, all the anti-finasteride guys come out. It's like, brother, I'm sorry. I've been on the drug for over 30 years. I have the right to talk about it. I'm not selling poison. I don't sell medication.
You don't sell anything.
Well, true. But if I did sell medication, meaning if I was involved with one of these companies selling medication, I take it. I take the stuff. It's kind of like getting upset with somebody who takes whatever medication, say birth control, because you ended up getting a blood clot or having a stroke because you're on birth control. That sucks.
I just came up with another real idea for you.
All right.
You take it yourself, yeah? Pics or it didn't happen. A reel of you taking your finasteride. Then you can say, you guys have seen me take finasteride.
I could do that.
Because we don't know. We don't know, Spencer. Are you actually taking it?
I will take it with a bottle of Jack and a cigarette in my hand. I'll just swig on that bottle
I'm on my
of
way.
Jack. Yeah. Just swig on that Jack.
Right.
What's going on, Joe?
Not a lot. There's some things going on in the world of hair loss. There's actually development at, I don't want to say development, but a research finding at Harvard. But I don't want to get people excited about it, to talk about it, like as far as like the thumbnail for today's show. And there be some sort of,
doesn't excite anybody anyway, but go ahead.
Well, it would. And I looked at it and I thought, okay, yeah, I can make a thumbnail about this and I can promote it for today's show. But then I thought, man, I don't want the bloody heads in my hand, because it has to do with wound healing and the neogenesis of follicles that occurs from some wounding situations. And I thought, shit, there'll be those guys that will be out there watching, and they'll be like, oh, okay, I'll do it.
And
it's like, I don't.
They already are. So I mean,
I don't want to make it worse. So.
Describe it with the caveat and the explanation of, no one understands the long-term ramifications of this. I mean, we see it. We see it in practice. I've seen it for years. I found the video.
I had it myself. Yeah.
Yeah, but I found the video. I think it was like one of our streams from 2014. When I'm talking about it, no one, and I hate to give myself credit like this. Well, I mean, I am, though. It's not about patting myself on the back, but no one was talking about it. Someone asked about dermarolling, and I was just like, dude, you do not want to do that. And I explained that I was given a dermaroller actually for my face. I tried it a couple times, and then I really did some research, and I thought to myself, for some reason, this doesn't make sense. And then I learned about collagen reformation and the fact that, kind of like hair cycles, you really only have a finite amount of collagen reproduction, turnover in your lifetime. Mm-hmm. And that sounds like, well, how do you know that? They're finding this out. So the faster you interrupt that natural process. So the more often, the less things are going to be going to work out for you in the end. So what's going to happen? You can end up with, especially on your scalp, thinning scalp, more microscarring that's going to add up into more of a confluence of, microscarring across the entire scalp. It's going to eventually make it difficult for hair follicles to grow in a full, robust fashion.
Well, it's interesting you said that, because what the researchers found out, and I did find this interesting, like it's something I want to look into just because I'm a nerd. They were doing, and of course it's mouse subjects that they're working on, but they're looking at the healing properties of skin in prenatal mice that were just a few days shy of being of birth, and they would wound the skin, and it would heal with no scarring.
Yeah.
And then postnatal, like a few days after birth, they would do the same on different subjects, and there would be fibrosis and scarring. But what they noticed was that there was a rush of new nerve connections into that immediate area of wounding, and that is what was preventing, that's what was preventing the skin from healing properly, and also preventing any sort of neogenesis. But when they injected some sort of enzyme that blocked that nerve formation in the immediate area of wounding, there was no scarring and there was neogenesis.
If you notice, my eyes have already glazed over, brother.
Yes. But there are the nerds out there that are listening. They're like,
Yeah.
Tillman, that's awesome. I know.
Yeah. All these young guys, and listen, we still see it online. It amazes me that these influencer dermatologists will promote this concept of either abrading their skin using a dermal pen, a dermal roller, telling people to put minoxidil on directly after you're abrading your skin. It's amazing. Listen, it's interesting that these guys have gotten, I guess it's because they put out so much content that's palatable and I guess interesting to, in general, a younger audience. Mm-hmm. But it's amazing that these people have MDs. They're, in quotes, board-certified dermatologists. I say in quotes because, yeah, they're board-certified and they are dermatologists. But it doesn't mean that they know anything about this particular subject. But they're putting it out there because they are authorities. They are MDs. Mm-hmm. They don't realize the harm that they're causing. There was one doctor that came out recently who has a very huge following, who has been promoting this for a while, and she was using it on herself, and then she kind of is now backpedaling and saying, not even backpedaling, stated clearly that she no longer believes this is a good option, and these are the reasons. And I noticed on that particular reel, there were a lot of comments from people who were doing it for like a year because of her.
Ooh.
And she wasn't responding to those.
You blame her? Yeah.
So and then there are people out there that really hate the fact that I, for whatever reason, just, it's not telling my truth. This is just the truth. And also, it's going to save you a hell of a lot of time not to have to deal with this shit every day, to have to deal with dermarolling or dermal stamping as part of your routine. And I know there are guys out there that have had long-term good results and they've incorporated this abrading of the skin, but maybe they do it once a week or once a month, and somehow this is attributed to their success when we know it's not.
Well, and that's a problem that I've always talked about of starting one modality or multiple modalities at the same time, is you don't know what the hell's working. Like you could have this amazing result, but if you start getting some sort of side effect and you have to stop taking the medications causing it, you have no clue what's causing it.
100%. Look at this kid Zeph.
You're lost.
And again, I want to make it clear. I think what this kid Zeph is doing and the way that he's approached it is, in the end, I think he's helping a lot of people. I think he's a really good guy. It's just he went down the wrong path initially himself, and while he's out there building his influence, more and more young guys were following that path. Now he's on a path where he's still switching his meds. But as you kind of watch his journey, you kind of see all of the mistakes that are happening along the way and things that could have been mitigated. Now, with that said, he's very fortunate. He's done very well. I will always say, even though I don't particularly love certain aspects of how this particular physician treated Jeff, he has one of the best executed hair transplants out of any influencer in the space. That's all I'm
It
saying.
looks good. Yeah. It
Not only
turned out really nice.
Not only does it look good, it was well executed from the beginning, except the only issue, in my view, with the execution was that I believe too many grafts were moved in the first pass. We really don't know what the growth of those, the extra 2,000 grafts, which I don't think should have been, or 1,500 grafts that could have been saved in his donor, given that he was just starting oral medication.
Sorry, did he have a second one?
I think he's going for a second one now.
Oh,
But-
why?
I mean, he wants more density. I understand that. But I think that and again, I'm not a physician. I've just been doing this for so long. I do believe if this was done in stages and he took a little bit more time and it wasn't quite as much, and maybe they weren't looking for this initial wow factor from where he was, that if he was guided in what I believe to be a more reasonable way, maybe 3 smaller procedures would have done the trick. In the end game, in the end, he would have gotten where he really wanted to be. We don't know how many of those grafts were lost. We don't know.
How long ago did he have a surgery? It was less than a year and a half ago, wasn't it?
I don't know. I think so.
Roughly a
can
year and a
check.
half ago.
You can check. It's online.
I think maximum a year and a half ago. I think it was less than that. And the way that he's been changing his medications midstream, still waiting for the final result. And here he is a year and maybe a couple months post. Considering where he was, he's got a clear case of hair greed if he's looking for more density. He's rushing into it. There's a high probability that even before surgery, his hair can go into some sort of flux of additional loss.
Beautifully said, actually, and that's important you brought that up.
Because of antigen synchronization post-operatively, because of
these new headphones are going to be the death of me.
Any sort of issues that can be influenced by the new medication switch up or the change in medications in effluvium from that, and then he's thinking about having, or he's booked for another surgery. It's a high probability of disaster. Not saying it will.
I have to be candid with you. Sometimes I see his stuff coming through my feed and I'll watch it for a second, and I'm a quick scroller like every other idiot out there. I haven't paid really close attention. But from what I can see from my blips, as far as just seeing like 30 seconds of content, I think he's switching from his oral finasteride to dutasteride because of course, because he thinks he's losing ground. But the reality is
he has no idea.
But I also believe that that's part of the transplant process that no one's telling him about.
Yeah.
So I just think he's getting, I don't know. Listen, he's going to a real doctor. He's being treated by a real physician. He's being treated by somebody who is, in general, executes hair transplants fairly well, and in some cases, exceedingly well. I just think that his notoriety online and his influence online has kind of helped, not even helped, but maybe some of the people involved with him now are making decisions that aren't necessarily in his best interest and kind of presenting him with these choices that in the end may not really be in his best interest. That's all.
Well,
I kind of wish he would have reached out to us, and I would not have asked him to do anything online or anything like that, just to kind of get a second opinion.
Well, there is the fact that the more content he makes because of these changes, the more content he has to share. Not saying anything other than that. It's just, a nice coincidence.
Dude, you never look at the good side of people.
No, I don't. Because this industry sucks. Everyone involved in it sucks. And
That's
people
true,
need
but
to know that.
I like to give him the benefit of the doubt and think that he's kind of being naive. He's trying his best. Yeah, he wants to make $1. There's nothing wrong with that.
Oh, no. I'm not
I
saying
think he's being guided in a really. Yeah,
let me be clear. I'm not saying that he's doing it for clicks. I'm saying he's being influenced to do things for clicks. Because
Maybe.
the clicks all lead back to someplace, not just for him.
Look, I think if you really look at this guy, listen to his speech, the way that he speaks, his cadence, just the way that you could just sense that he's a good person. That's how I feel about this guy. I don't think I'm wrong about that. I just think he's gotten involved with kind of like the wrong element of this field to some degree. That's all. And I think his end results as he got older he would have had more hair in the bank. I think that if his medical therapy was monitored a little bit more closely and he was given a little bit more reasonable advice and kind of an understanding of what he may be going through now, I don't think he would have been switching up his meds the way that he is. No. But again, I don't know the full story. I'm being candid. I don't watch him that closely. I just happened to see something pop into my feed, I don't know, the other night, 2 nights ago, and I was probably stoned.
I can say that I don't know what his voice sounds like because I've never watched anything enough to hear his actual voice and remember it. And I see more of him in these ads for off brands that are selling their own topical formulas, using his likeness.
Oh yeah.
Most likely without his permission because of the way that they're presenting it is a
100%.
complete fraud. Just like they're also doing with John Cena. And it makes me wonder, like, where's the lawsuit? When's it coming?
It's going to be very difficult. And he's trying to build his own brand, so he's going to have some problems. I have the same problem with the penis enlargement pill people. Just kidding. Phone number is 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from? Caller, what's up?
Hello.
I'll give you 5 seconds to say hello. So if there's someone out there who doesn't realize that we just picked up and is holding on, just say hello. Goodbye. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hey, it's Drew from Ohio again.
Drew from Ohio.
Drew from Ohio again.
Again?
Jesus.
Again.
What's going on, brother?
You guys are talking about a topic that I've been trying to figure out for a while, so I thought I'd chime in.
Yeah.
Sure.
I'm looking. When I call, I always ask for hair transplant questions, but
we know. My God.
Well, what I was trying to do is utilize my time in the call a little bit better, and you guys are talking about a topic that kind of covers that. So I'm thinking about, I've been studying the medication I've been taking for 4 years. Every now and then, though, when I look in the mirror and I'm, getting ready for my day, I notice, like, there's subtle differences in, like, density, almost like a diffuse kind of look in some places, but the hairlines, for the most part, have been pretty steady. Mm-hmm. So I was thinking, when it comes to doing a hair transplant, would it be who would be the best to work with on you guys' list to make sure that I'm doing, for the most part, all that I can do as far as medication goes and other therapies before I jump into something that's permanent?
I hope you take this in the spirit that it's meant. I need to jump in for a second, Joe, just to clarify this.
I know. I expected this.
I don't have a list. I founded a organization which is considered to be a consumer-facing medical society, essentially. At the time, we were doing our best to separate the doctors who were doing a really solid job from all the rest. And that has been, we're going into our 25th year. And I just hate the idea that there are still people out there, and this is not your fault, but who are in this industry who still refer to the International Alliance of Hair Restoration Surgeons as a list. And Carl, that's not your fault. I just wanted to put that out there for public consumption.
I understand. Yeah.
Yeah.
I just know that like Joe works with some people that, that I watch all his interviews with them, and they seem like they're pretty much on the up and up for whatever qualifications, he deems as necessary to add to his.
Well, I mean, Joe has a list. I'm
suggestions.
just kidding. What Joe does is well beyond just having a list. Joe, you could explain it.
No, you're doing a great job. Keep going.
No, I mean, what Joe's done over the years is, I mean, not only has he actually vetted these guys. I mean, this guy has been. You talk about being in the trenches. Listen, there are lists out there. People just create lists. They put it out online. There's a lot of like young, new influencer types that create things. There's guys on Reddit that created these crazy lists that they have never actually been involved in these clinics. So, what would you call what you do, Joe? Exactly, you're a strategist.
Well, as far as my
Dude,
position,
I feel so, Carl. I'm so sorry. I'm not chastising
you didn't expect
you
this.
at all. You didn't
Drew,
expect. You just want
Drew
help.
did
Drew.
not
I'm sorry.
expect this. Drew just wanted to get some solid information, and he's being read the riot act.
We're going to
Drew,
give.
I'm sorry, buddy.
We're going to give you the solid information. It's just this is just something that chafes my ass, and it's not your fault.
I think a nerve was touched. Drew, what do you think?
It's possible, but
No, it's all good. It's all good. So to address what Spencer's talking about, I'm a hair restoration strategist in that when people, laypersons are contacting me for advice or for what most would call a consultation, I call a strategy session because I help come up with strategies other than just surgery that can help deal with the issue that you're dealing with. But with regards to the doctors I'm working with, it's an association of doctors, not so much a list. I mean, it's a list because you look at it, it's a list of doctors that you scroll through, but they're doctors that do actually have to go through a vetting process that is more than just me looking at their website. And what do I mean by that? Well, it's funny. I was actually contacted by a doctor in Europe. I've known him for, 12 years now. And he contacted me and he said, I really want to, get serious about, working with you. What do I need to do? And so I sent him a, wait for it, list of things to do that he needs to provide for me. One of which is actually a copy of his most recent inspection report from the governing body in his province of the country he's in, to show that his facility passes inspection according to local standards. No one else does that. But he was telling me that he was surprised at what I'm asking for, because the most recent admission that he was given onto a list, he contacted the proprietor of this website and said, what do I need to do to be a part of this situation? And the guy said, send me your website. Less than 2 weeks later, there's a profile on the website. There's, the whole 9 yards. He's a part of it. It's because someone looked at a website and that was good enough.
Yeah, and to be candid, Joe will reach out to me because one of his prerequisites is that they're IHRS members. I know what Joe's doing with these guys, so I let him handle that part of it.
Yeah,
and then if we bring them on, we bring them on. So that's
so when you see coming
Drew's
on,
like, so okay, great. So tell me who to go to.
Yeah, exactly. Yeah. so on my website, when you see people that are accepted members, it's because as Dr. Manny Mittal said one time, he said, it's like going through, it's like submitting his thesis in college. Like it took him 7 months to get in. So there's a process. That's a legitimate process. It's not just looking at pictures and saying, okay, you're in. So it's more than a list. I know what Spencer's talking about. It is kind of annoying, but it's more than that. There's a lot more than that. But like Spencer said, Drew, just tell me who to go to.
And by the way, I
yeah.
misspoke by saying medical society. We are considered a society, and places like, in order to practice in Dubai, they one of their prerequisites is that they want the physicians there to be a member of the International Alliance of Hair Restoration Surgeons. So we have to give these people a note, essentially stating that these guys are accepted members, and then they can go over there and practice. So we've just kind of grown at a much different level, and so that's why I wanted to put that out, especially for physicians who are watching this, for people who are applying to the group, and also for young guys or anybody who's really looking at all these different resources to understand what they actually are and what they mean. There's a lot of misinformation on Reddit, but with that said, I think it's what?
As we're talking about this, here's another influencer on Instagram popping up. Who's the best on earth, regardless of money?
Oh yeah, well, and that's the biggest problem that we see. So that's why we kind of want to make it clear. But as far as giving you a specific doctor who's the best for your particular situation, that's impossible to respond to. You explained your situation, if I can remember correctly, is that you look in the mirror, you've been on this medication for a while, you've been really studying your scalp, as we all do, and at times you think it looks fine, but you notice that the hairline is pretty stable, but there's a diffuseness around your hairline or behind it, right?
Yeah. I should add that I'm an MS patient, so I'm getting treated with medication that kind of brings the immune system down. And I've seen some effluvium happen with that. So it's quite possible that that's what's happening there. And I'm trying to work with a doctor that will take, medical situations, in their further decision making as far as if the surgery would be a good candidate or not.
Well, if you have the integrity of your, hold on, just got a funny text. Somebody texted me, "Poor Drew," because he really read you the riot act. Sorry, brother.
I feel bad now myself because I didn't want to reduce you guys'
No.
I
just saw it as a great opportunity.
Has a lot of respect for you guys.
Listen, I saw it as a great opportunity. I definitely knew what you meant. I didn't take it that way at all. So, but I appreciate you saying that. But in your particular situation, and it's unique. Medication could be playing a factor. For sure, especially if you've maintained the integrity of your hairline, and I'm assuming you're maintaining your temporal points as well if you kept your hairline, right?
Yeah, it just seems to be a little bit like I'm losing a little bit maybe on the left than I'd like, but for the most part, it looks like the right side almost started to come back, just looks a little diffuse. Okay,
so do you notice that things have Wayne, did it get better and you were satisfied with the results and then things started to diminish over time?
Yeah.
Okay. And was there a connection to when you started to take your other medication?
Well, during the, I think it's 4 to 5 years that I've been on it, I did the thing I shouldn't do, which was what Joe was saying about throwing the kitchen sink at things. Yeah. And I threw PRP in there. And I have not gone back for, further PRP treatments. So it's possible that some of that loss, was from something that wasn't going to be permanent anyways.
Yeah, and that's a good point. So you're not doing PRP right now. And honestly, I have to say that in my view, for the most part, PRP is one of the biggest money grabs in this field. There's a handful of people who are doing it well, but it becomes very difficult to recognize what's working, what's not, what's causing harm, what's putting you through an effluvium if you're adding all these things. So you're right, to express, what Joe says. And we've been saying that forever. You may just be at a point now where you think it's just like not looking great. And in 6 months, you could recoup whatever you maybe have shed in the last few months. But it's a good idea to still get checked out. You can see a physician who's able to do, use a densitometer or a handheld, what are they called, Joe? Handheld digital microscopes.
Dermoscope.
Well, a dermatoscope, a digital microscope, whatever, and really kind of check your entire scalp, do some miniaturization mapping, and kind of watch the situation. And, they'll be able to kind of lay out certain parts of your scalp, map out certain parts of your scalp, keep that data, and then you can go back in 2 months or a month and see if things are continuing to decline or if some of the vellus hair or the weaker hair or the miniaturized hair is actually becoming more robust. And this way you can really track what's happening.
How often do you think that you would have to do something like that? Could you just go the once or twice and they could feel confident in something like that, or do you think that'd be something that?
No, I think you have to be tracked for a minimum of 6 months before they could really tell what's going on.
I do have an appointment to go see Jerry Cooley at the end of the month. So
there you go. Yep. He's the man.
Well, then you're stuck because he's not going to do anything. He's just going to track you until he knows for sure.
Yeah. But he's good to work with for things like that.
He's the GOAT.
Yeah,
I love that guy. Okay. He is so good at the non-surgical. Surgical stuff. Obviously, he's like one of the best in the world. But he, very few people know this, but when he was doing his internship at Johns Hopkins, one of the things that he was doing at the hospital was he was investigating and researching, experimenting with real hair cloning. 30 some odd years ago, 40 years ago. And
wow.
And he's been involved in the hair regeneration side of things ever since. And it's because of him that we have hyperthermosol for grass storage that all the best clinics use globally. I know the story behind that too. He shared where that came from, why he started using that. And hyperthermosol is actually used for organ transport, like heart and lungs from one place to the other. Once it's harvested, it's put into a hyperthermosol solution, obviously cold packs as well, medevacing over to wherever it's needed. And that helps to preserve the tissue. And so that's a great development for the industry that he's contributed.
Poor Drew. He just wants to know if he's good.
He's one of the first to really look at A-cell and PRP, things like that. And he came up with one of the few. Spencer mentioned there's only a few guys doing it right. He came up with one of the few formulations or protocols that's actually effective. Same thing with exosomes and the way that he's doing it. I've said this for years. So Spencer, that no two PRP recipes are the same. They're different from one clinic to the next, and unfortunately, it's become a standard reference. Come get PRP. But the only thing that's standard across the board is they draw your blood. Once they draw your blood, what happens to it is completely non-standardized.
It's also not standard amongst the same person. You can go to the exact same clinic, but unless they know what they're doing, they have to test your platelets. Once you get everything drawn, and every time you get your blood drawn, it's a kind of a different situation, different scenario that they have to work within in order to create the platelet-rich plasma that's going to be good enough to actually help you with your hair loss. None of these guys are taking measurements. It's all just draw your blood, put it through a centrifuge, use whatever kit whether it's an open kit or a closed kit. Some of these kits aren't even FDA cleared. Most of these companies have no idea what they're doing, especially these med spas and board-certified plastic surgeons' offices and dermatologists. He's a handful of guys that actually does it right. So you're in good shape.
In mine, the blood wouldn't even spin when I got my PRP the second time. It wouldn't even spin, and they said we couldn't get the plasma to separate correctly, so we're going to have to redo everything. And it's like $1,500 for three sessions.
Honestly, brother, it is the biggest money grab, and a lot of that has to do with the companies that are making the kits, and just kind of the way that it's been positioned in this field, because people are so desperate. Now, these companies can charge less for the kits. They can definitely work on volume, and physicians could charge less as well, but we're also desperate and vulnerable. I mean, I think it's it's really ridiculous.
Yeah, I remember the guy in New York that was making bank by charging $5,000 a pop.
Yeah, I think it was $4,500.
And people were buying it. People were signing up.
Oh,
like that was his thing. He was all over YouTube, he was buying ads.
It's the
to be on
women
YouTube
it's the
everywhere.
women who I really feel sorry for. I feel sorry for the guys too, but the women are so desperate. They're all rushing to their local med spas and plastic surgery offices or whoever to get PRP, hope against hope. And most of them are not being helped. And they're being sold packages, and they end up spending $10,000 or more for nothing.
Yeah. There's a guy at my barber shop the other day. He got FUE done from a local guy in Michigan. And, I think it was like $2,000. And then I looked at him and I said, so what medication did he tell you to use? And he was like, oh, I'm not. I found out there's side effects. I'm not going to do that. I was like, do you really want to lose all the work you just did? But it's just sad. These doctors just send them on their way because they're desperate to look a certain way.
Dude, that $2,000 is going to end up costing him $50,000.
Yeah.
Because he's going to be.
So,
if you're getting a FUE hair transplant for $2,000 in Michigan, you are effed.
Yeah.
Completely. But yeah, I mean, listen. We always say it. I know someone in my personal life who benefited from going to the right physician for PRP or the right, actually it was a physician's assistant and a PhD for PRP for over a decade. Life-changing as far as like being able to maintain hair, slow down there was a cessation of hair loss for many years. So I'm a believer. I was one of the first believers, honestly. But there was only one guy at the time that I really believed in. This was Joe Greco, who's kind of like the granddaddy of PRP in this particular field. But Cooley's right there with him. So you're in good hands, and he will be able to give you a strong medical diagnosis and also or assessment, and also kind of understand and factor in the medications that you're taking. But you're going to have to be watched. I mean, given your situation, you have to be monitored, and surgery is going to be off the table for a while. It may never be on the table.
Yeah, that's what I'm afraid of. I just want to create more of a balanced look, not bring back what I had, obviously. But like you say, if it's off the table, I want to know it's off the table so that I'm not doing something I regret.
Well, and here's the thing about things being off the table. It could be off the table for 5 years, but then all of a sudden you're stable. And maybe you switch medications or things have improved for you, and then it'll be on the table. The key is to try to maintain whatever you can for as long as you can and do the best with work with what you have. Is there a way for you to maybe use cosmetic concealers, fibers, or something like that to kind of add that balance and still look natural?
I kind of use a combination of things to achieve that, yeah.
Okay. What do you use?
I just use some like volumizers and things like that. Some pomade that has like a fiber volumizer in it, and it gives me, a decent look. I mean, God forbid the wind hits me, but
Dude, who are you talking
it holds
to?
up okay.
Exactly.
I got here today. Joe's like, "What's happening?" I'm like, "I'm having trouble with the sculpture today. All right, just give me a second." This is my life, and if it's super windy out and I don't want to deal with doing my hair and spraying it shut, I just throw on a baseball cap. But if I would have jumped into surgery early and done all the things that people do, there's a good chance I really would have been effed.
Got one more question for you.
Sure.
If I heard you say something with Joe about switching, or that influencer that you guys were speaking of, basically said something along the lines of wanting to switch from his finasteride to dutasteride. And I've often wondered sometimes if it's kind of silly, because I know they kind of do the same thing, but switching from dutasteride to finasteride to see if maybe I just wasn't it didn't work well with what I had going. I don't know if that makes sense, but I've heard people say something to the effect of trying the other one. But I don't want to lose complete ground because I don't know what dutasteride is holding on to.
That's the problem with all these medications. Once you're on it, you're on it. And if you see any reasonable results and you're not getting adverse side effects, you could be taking a huge risk by switching just to switch. Now, I've known people who've done it very successfully. I think young Tom Gilbanks, who's becoming a big influencer in the space, is a trusted content creator of the American Hair Loss Association. He ended up switching from finasteride to dutasteride, and he's doing quite well. But he's also on, I think, low-dose oral minoxidil. I think he's also taking the, at least the cosmetic form of Kintor's product that we talked about yesterday. So he's all in. This is a all-in kid, but he's been very fortunate. He actually just had his hair checked out and mapped by Manny Mittal in the UK. Mm-hmm. I got to tell you, man, he's a donor hair. His donor hair is unbelievable. He's donor mogging, as they say.
Yeah.
Excellent.
How old are you again, Drew?
I'm 38.
Okay, so you're young, but you're not that young.
Right.
But, I mean, you probably have a reasonable-looking head of hair for your age, I'm assuming.
I've sent some stuff to Joe, but I know Joe's like, you got to be exhausted with all the things you got going on. But I did send some emails. If you look through there, you may find them on your admin. But I don't have social media. It's a lot of drama. I don't do it. But if you get a chance, check through your emails. I think I might have sent you like the one or two, just in case the one didn't make it through.
Do you know how envious I am that you are not on social media and you could live your life? I'm telling you, there's no way that I would be involved if it wasn't for what I do. I would just be like,
about the extent of it.
Say that again?
YouTube's about the extent of it.
Yeah. I mean, I watch a lot of YouTube on my television because now it's like, but still, I can't watch anything more. It's very difficult for me to watch an entire movie right now at home. So I could watch like a documentary or whatever, and I could watch stuff on YouTube. But once I start going through these shorts, man, I notice that my attention span kind of like gets less and less. And there's definitely a psychology and a kind of a physical thing with dopamine, I guess. I can't even imagine what it's doing to these kids' brains, to tell you the truth, because I'm affected and I'm 60 years old.
Exactly. Yeah. I'm affected. For sure.
Joe's
there's all these lawsuits going on with Meta right now and stuff like that, and YouTube too. But yeah,
it's pretty heavy, But yeah, I mean, I think they're going to try to contest it. But I think I don't know what it wasn't punitive damages. What were the damages for? Anyways, like a total of $6 million for this one case. But that will set a precedent that I don't think these companies are that excited about.
No.
There's going to be a lot of lawsuits.
Unfortunately, there's not a lot of content creators that do what you guys do and sum up everything that you heard and sort it out and say, okay, this is good information, this is bad information. And there's so much information that we're like, how do we filter this? And we're just not only wasting time, but we're becoming more addicted.
100%. And also, here's the thing. We don't get the visibility that these influencers get, who are just essentially creating hooks and promoting bullshit in general. That's just,
Right.
I noticed, I grew my social media presence on Instagram. It happened pretty quickly, but the way it grew was because I had to dance around like these idiots, essentially. And I popped a few times, and it grew like wildfire. So
you did dance around, actually. Yeah.
So I, I did different cuts. I I put a camera in my refrigerator. It was ridiculous. I'm an old man, but it worked, And I realized, okay, this is what's so. But now I think things are changing, because I notice if I post something that is just like me in my bathrobe or whatever, just talking, I'll still get 50,000 views or whatever, and it doesn't go viral, but it's pretty consistent. So I'm going to be putting out more content. I've just been turned off by it, I'd say the last 6 months. But I'm going to be putting out more content now that I think I may not have to jump around like an idiot.
That'd be excellent. I mean, you guys and Kevin, man, like the two people I followed, or three people, sorry, Joe, that I follow the most. So
Kevin has a very unique, and again, Kevin, if you're watching this, forgive me. I don't watch your stuff enough, but the stuff that I have, he has a great engagement with his audience. I could see why people are very attracted to him.
Yeah.
to watch him. I mean, it's very unique.
I will.
He speaks the truth when it comes to at least finasteride, dutasteride, things like that.
I will be completely honest about Kevin Mann. When I first saw Kevin Mann, and for the first while I knew that he was around, I thought he was, how can I put this? I didn't like his presentation only because I thought it was crazy actually, and not in a good way. Like God, like look, God, look at what he's doing. And then I watched some more over probably the course of a few years. Like I was never tuning in and watching any videos all the way through, but then I started to appreciate what he's doing because I think that part of it's an act just to get the attention of these guys that are following him very closely, and I respect that. And the last few times I saw him, it's like, you know what, I get it, and I respect it, I appreciate it, and when you do look at the message, when you do go beyond the the hair flipping and the sup shrooms or whatever he says, which was a great.
I like
hook.
that. I think
yeah.
sup
Video
shrooms?
game references.
Sup.
It does resonate with a particular audience, and he is getting pretty good information across. So props to him. I think he's one of the good guys.
This isn't shade on him, but I have the kind of like the sense of humor and sometimes the attention of like a 12-year-old, and things like that really capture my attention. It's like it's very engaging. And so as soon as I saw him, I'm like, I saw something in this guy. I'm like, okay, this guy's going to do really well. And that's without even spending a lot of time watching his content because I'm lazy in that way.
Yeah. No, yeah. And he's really raw, though. To Joe's point, though, it is very different and it seems unorganized. But I think that rawness, after you've seen him a few times, you're like, okay, so when he says something, he kind of means what he's saying. He isn't like theatrical. He's just saying what he's saying, and that really helped, at least for me, when he delivered, the truth about, what the meds, do and what they don't do. A lot of the stuff is in our heads because we've been told online, and I hate it. I found this old news clip years ago,
dude,
of a guy who took medication, and he was saying he had all these problems, side effects, and that scared the shit out of me when I started losing my hair. And
of course, but listen,
I could have saved so much.
You weren't hearing anything about this before 2006. No one was. We weren't. Spencer and I have talked about it ad nauseum. It's like, it's like before 2006, like it had already been out for almost 10 years. No one, like, and I was in the clinic already for 3 years every day talking to patients. I never heard about this.
Well,
doctors had never heard about it.
I did. I was alerted to a small Yahoo group that ended up turning into that bigger group in about 2003, and I actually mentioned it on the program.
See, Drew, like I'm trying to get a point across. He's got to correct me. You see how this operates?
I just want people to. This is about the truth here. We want to provide them with good insights and real information. However, the way that it was presented online at the time, I definitely thought that the 10 people who were involved were having at least, in my mind, I would say at least half of them were having psychological issues. And, I'm not sure about that. But it really did then start to explode as these guys started to make their way outside of that little sphere. So Joe's right. It really didn't come to anyone's attention until about 2006. So you're talking about...
Which coincidentally is when the generics came onto the market.
Right. So 14 years after the original 5 milligram Proscar was approved. And it wasn't being talked about in the urology community. It wasn't being discussed in any of the hallways of conferences.
No.
I heard of one instance of someone during the clinical trials, maybe it was 2 actually, who, as they were following them initially, they had adverse side effects, they dropped out, and they were complaining of some persistent side effects, but not complete, from what I understand, eradication of the libido or erection. And that could happen, obviously, but when it comes to sex, there's a strong psychological effect with men. We've all had it. Maybe Joe hasn't. But when you're a young kid, you meet somebody new, you have performance anxiety, or if it's your first time, and all of a sudden, wait a second, why isn't it working? But if you relax a little bit and don't let it rule your life, everything's fine. You know? So some of this could be really just performance anxiety to a level that maybe a lot of people just can never really comprehend. So
Right. Well, then there's
yeah.
also the adjustment period too. Like on any medication, for me, I had like 2 weeks of depression when I started finasteride. I'm not saying it's going to be that way for everybody, but I knew that might be a chance, so I gave it some time, to adjust, and I was fine.
Listen, and the people out there that are going to maybe clip this and make it appear and twist this that I believe that there's no adverse side effects and that I'm out there pushing poison and all this stuff. I'm just speaking from a position of I know what's out. I've been doing this for so long. We understand the data. We know what's at least been able to be provable, and none of this stuff has been proven any type of causal effect. That's just the facts right now as we know them. Now that could evolve. That could change in time, but
Yeah.
it's weird. That's all I'm saying. From 1992 to 2006, essentially, where are all these people? Where are the guys that are taking 5 milligrams? I was taking 7.5 milligrams at one point per day. Now, I'm not saying, listen, everybody's unique. But where
Right.
are all these people? I mean, the initial, 12 years or 13 years of use, this just wasn't out there. So who knows?
Yeah, unfortunately, there's just like the way this is being presented medically is like, I don't know, just seems kind of lackluster for something that could be better. And also, though, it's divided between, what is medical necessity versus what they consider to be, vanity. I've actually had a doctor say that to me, it was like, you'd only want that surgery if you're looking for vanity. So I was like, so you give up on the fact that what we are all going through in this community is like depression, and how can we start solving, parts of, at least in this country, that we can control, looking for better ways to improve depression. Accepting yourself is good too, but it's also, I don't understand certain things, why insurance wouldn't help cover certain surgeries if it helped you with depression and we didn't have this kind of social chaos.
There are different, skin cancer is just incredibly prevalent in this world, here in the United States and in Europe. And the gold standard for non-melanoma skin cancers is still Mohs surgery, which is like 100 years old, over 100 years old, essentially. The reality is there are other treatments that work. There's like extremely low-dose radiation therapy that basically it's not even like, it's very low-dose radiation. It takes a couple of sessions. You have a skin cancer on your face, you can get that taken care of. It has the same cure rate as Mohs surgery. So why wouldn't someone or insurance company pay for that first as opposed to having someone cut your face open and they'll pay for that? It's insane. And there's also laser treatments now that no one talks about that are incredibly effective. And there's also ways to basically do non-cutting where you don't have to actually cut the tumor out or slice it up and do basically a visual biopsy using certain devices that were originally used to check deeply back in I forgot what it's called, but you're checking, what are those devices that check the back of your eye, Joe? Do you know? Anyway, so these are now being used by a handful of people around the world for many years for skin cancer. Incredible cure rates and treatment rates and completely non-cut biopsies. You don't have to cut these things out to make sure that it's skin cancer. Imagine that. Insurance doesn't pay for that stuff. No one has even heard of it.
Yeah.
So
it just seems like there's like a disconnect in certain.
Are you talking about an ophthalmoscope?
No, that's not it. It's like a coherent.
Optical coherence tomography.
That's it.
OCT.
Yeah. OCT. Yeah. It's amazing. And actually, you can see like the branches of the cancer. You can see deep into the through the epidermis and the dermis. and they can see exactly where this thing is without having to cut, any part of your body open. But no one's using it because insurance companies won't pay for it.
Yeah, it's unfortunate that the medical field doesn't get together, and present things better to people. But like I said, I know you guys aren't recommending that you do or don't take medication, so I don't want to be responsible for any clips out there. But yeah, I mean, people should definitely talk to their doctors and see their options. And I think that's what the point of my call was, just to make sure that, waiting this out and maybe talking with guys that have been doing this for a while was the better option than to just rush into anything else.
Brother, you would have, given your situation, to have a hair transplant and rush into it, it probably would have been a disaster.
Yeah.
Yeah.
And
like I said, I've been to a few different people so far. I've got about a handful that say do it, and then the other ones that say, well, you could do it, but you're risking things going wrong. So I was just trying to see if I can maintain and see what's possible down the line. Like you said, I'll just
there's also based on the description of your loss, and then some doctors saying, yeah, we could, but it also tells me that potentially you don't have actually enough loss to where surgery would be warranted to begin with, despite everything else. Like if you came in just a patient off the street with no known issues and everything's fine, it's just you got some thinning going on, it doesn't even sound like you've got enough thinning to justify surgery in the first place. I could be wrong, just based on what you're saying, though. It sounded like the area that you're concerned about is at worst a slightly mild diffusion of the hair in those areas that could turn around, like Spencer alluded to earlier, in 6 or several months, just with time, based on you being consistent with what you're doing and not getting all experimental on your ass with different options out there. Just stay the course. But it just look, there are a lot of guys that have issues where they look in the mirror and like, oh, my hair looks thin in one spot. Sometimes, is surgery the answer?
Yeah.
No. 9 times out of 10, no, it's not, because and I understand it's all relative as far as how seeing a thin spot affects people, but there are the majority of the situation, almost every time, it's a situation of, okay, take a knee, take a breath, push through, stay the course, wait 6 months minimum to see if it changes, because it could also just be what some people refer to as seasonal shedding, which that's actually not a thing, because it's anytime throughout the year where you do have a synchronization of telogen follicles, where more follicles line up on the unknown schedule to where more of them are shedding than at this point last year, or different times of the year. So different follicles have a different timeline. So if 10 to 15% of your hairs are in telogen at any given time, that ebb and flow of how that works can all kind of sync up to where you maybe got more than that at any one time, or at a specific time, so it has more of a visual impact. But then 6 months later, it's back to normal because everything's kind of gone back to their normal cycles.
Poor Drew, he just wants to get some dinner now.
He just wants to know who to go to.
I feel like I've tied you guys over too much now. Listen, I know I probably will speak for the community on this, but thanks for all that you guys do. It does mean a lot. It's always good to hear from you guys, and appreciate it.
All right, Drew, listen, good luck with everything.
Thanks for calling, Drew.
And we'll be around anytime you want to call.
All right, thank you.
Take care. Bye-bye. Phone number is 888-659-3727. I'm going to complain on the air. Even moving my arm like this to fucking reach for the phone hurts. This is untenable. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Hi, this is Alex. I'm calling from Moreno Valley, California.
What's happening,
What's up,
Alex?
Hey, how's it going, guys? It's the first time I've called in. I've been following Spencer in the show for a bit now, but I don't know. Did you guys disappear for a little bit?
You know, sadly, we've been around forever. I mean, every once in a while we disappear, but
You just say, okay.
how long you were following me when? Just online or on the radio or what?
Mostly online, mostly on social media. Probably about 5 years, maybe now.
Okay. No, we haven't disappeared.
Yeah. So,
You know, I've actually taken it's got to be close to 6 months off of really making new reels and stuff on social media. I mean, every once in a while I'll do something, but
The show's been around, but the social media itself is kind of taking a break every once in a while. But the show's been consistent.
oh, okay. Right on. Well, I wanted to step up my game. I'm 52, and I started finasteride 12 years ago when I turned 40.
Mm-hmm.
And for about 5 years, I've been minoxidil 2.5, half a pill daily. I've been curious. I have no idea how things are going with the stem cell treatments.
Mm-hmm.
I don't know what you guys. I would love to just get any. If you guys are thinking that's working out there, or what? If you just think that's a total scam, or I'd love to hear anything you got on stem cell treatments.
Nothing works.
yeah.
Nothing. No.
Maybe with a little AI help, and you know, what do you say? You're 52.
Yeah.
Possibly by the time you start collecting Social Security, this will be over. So no, we really don't know. But you know, anyone who's selling stem cell therapy for hair loss online, or any type of stem cell treatment first of all, if you're buying anything that claims to have stem cells in it or exosomes in it or whatever that's being shipped to your house, that's all dead material. So it's ridiculous that that's being sold and people are buying it.
Right. No, I'm starting to see it more advertised. That's why. I mean, I had obviously it just kind of came out of nowhere for me. I didn't notice it before.
Yeah, any treatment that's being sold to you, that's coming directly to your home, that has any claims about stem cells, or topical peptides, or especially if it's coming through anything like a mainstream thing like Amazon or whatever. I mean, or if you see in your feed, stay away from it.
I'm
sure you know
always
that, but I'm putting that out there for everybody else.
No, I followed you enough to know better on that. I just haven't heard you talk about this at all, and just haven't heard anybody talk about it. So I wanted to just see if there's if any good results going on at all, or if it's just a total joke.
There are even some, I would say, reasonable clinics out there, wellness clinics out there that a lot of celebrities go to, athletes, things like that are, offering stem cell treatments. I mean, I don't know. I mean, what they are exactly, but they're offering these stem cell treatments for hair loss as well. I was in communication with one of these companies not too long ago, and all I can say is, and again, I don't want to name the company because I think in general they're doing a very good job in a lot of ways. But the medical director of that company actually said to me that, or stated, at least online, that she wasn't thrilled with oral finasteride or dutasteride, and she said oral minoxidil, all wrapped up with lowering DHT systemically, but oral minoxidil doesn't do that. And that they have different stem cell treatments, maybe platelet-rich plasma that they're seeing results with. And that kind of makes me raise a jaundiced eye about the entire operation. But I shouldn't feel that way because I think they are helping people. But even some of the best clinics out there with the highest level of respect, all these influencers are using, athletes are using, they are selling this stuff. And I think it's currently the biggest money grab in the field.
Yeah.
Do you not think that I would be there? Do you not think that I would be? I would fly these guys to my house if I thought this shit worked.
No, I get it. Yeah, no, I had a feeling this was your. I just wanted to confirm it. I just this has got to be too good to be true. I just all of a sudden, I don't know if it's. I looked it up, and now my phone is algorithming.
It is.
All
of course.
Yeah.
Yeah. Yeah,
Of course,
of course.
it is. So, yeah, right.
And you know,
So
I'll
I've
put
been
I'll put
doing
this in perspective for you. You know,
yeah.
PRP and regenerative medicine type of products started coming out onto the market. What, Spencer? 15 years ago, or almost 20 years ago? But
Say about 2006 maybe.
yeah, okay, so maybe 20 years. Yeah,
I've actually seen exosomes with PRP work for someone that I know, but you don't know
Yeah.
what you're getting.
no, of course, but the thing I wanted to say that puts this in perspective, it's been around. I was going to say 15 years, but we'll say 20 years for the record.
I could be wrong.
No one on this planet can say that they know of anyone that has been consistently taking PRP treatments, exosome treatments, anything like that for male pattern hair loss, and it's been successful in maintaining anything that they have or has brought anything back long term.
And there's only two products on the market currently that anyone can point to. Really one type of product. That's a 5-alpha reductase inhibitor that has shown any long-term results in any human being ever in the history of this field. So you see all this stuff about RU58841, these topical anti-androgens, these experimental drugs, copper peptides, there's now a new resurgence. This shit's been around forever. And there's not a single, you could scour the internet. You can get 10 AIs to try to figure this out. And it will not be able to find a single user that's been able to save their hair for the long term.
Nope.
Good night.
I hear you.
Enjoy that, and maybe have a drink. Didn't mean to give you bad news.
No. I was gonna have a drink.
Anyway,
Definitely gonna have a drink, anyways. But no, I just got home from work, and I'm glad I didn't catch the last one. I don't know if I missed the last one, but the last one I saw was the surgeon you had on.
well, by the way,
I don't know if that was
we
one
had Ken Anderson on. The mic wasn't working. I know you can still hear him, but I am gonna. I have it out. Someone's supposed to be doing this for me. I am going to be putting up as much as we can. We're going to level the sound out in case you guys, I don't know, want to hear it with better sound.
That's the last show I saw, and you could hear him, but it was really challenging.
Yeah, no, we're fixing that, and
great.
that's on me. I am a one-man band here, and he contacts me. He's like, "Hey, Spence, I want to be in town. I want to be on the show." I'm like, "Holy shit, brother! I took apart my entire studio to build my rehab gym, and it's just I have one camera set up, but I set it up. I'm really good with analog stuff, but when it comes to putting analog to digital, I'm not so great. I usually need help, and apparently I fucked it up."
Well, it was a little bit of a gong show, but it was you could hear him enough to make it out. It
Sweet
was fine. I appreciate. Take it from me. There's not a lot of shows like this, and I don't know if it's how many people are on here. I just haven't been around to see it. I guess I kept missing it, but now I follow this channel and. Yeah, I'm always curious about what's going on. So appreciate it.
So when you subscribe, you also got to make sure you ring the bell for all notifications, because if you don't, then you might not get the notification that the show's going live.
Do you follow me on Instagram?
Sure.
Yeah.
Yes, I do.
Okay.
I have been. Yeah.
Well, I promise you, I'm starting to put out some new content soon, and we're going to be doing lives on there like I used to. I don't know if you ever saw a live on Instagram, but it gives you access to call me on Instagram too.
I think that's where I found you originally a few years ago, and you're not as active on there. So
I would definitely say I'm not a prolific influencer at this point. Somehow I still have a lot of followers, and I will, or a decent amount, but I will make that grow in the coming months. And I'm going to have more time to put more effort into it. I see how people react to it, even more than doing something on YouTube. So, it's cool.
This is a weekly show. This one is on at this 3 p.m. to 6 is every Friday.
It's 3 till on the West Coast. It's 3 till 5 on Fridays. Usually 3-ish. Let's put it this. We don't like to say 3 sharp because that usually doesn't happen. But if you're around,
too much pressure.
If you're there around 3-ish, there's a good chance we're going to be on the air.
Well, cool. Right on. I'm glad you're around. I'm glad I'm able to catch these now.
Good luck.
But yeah, that's it. That's all I got. And thank you so much for your time.
Man. Thank you for the call, brother. Good luck.
Right on.
Take care. Bye.
Oh, thanks. Likewise.
888, I just hung up on him, sorry. 888-659-3727 is the toll-free number. We're live taking your calls. I'm Spencer Kobren, live here in Los Angeles. It wasn't really a gong show.
I like that, though.
But it's funny.
Show. It's like, thanks.
It's funny. But I will say something about Ken Anderson. The guy always has a good fucking attitude.
Oh, he's got the best attitude.
It's unbelievable. I mean, he's got to be unhappy at some point in his life about something. I hope he's not. But I mean, I've never seen somebody. Actually,
you want to know why?
Alan Bauman. Alan Bauman's a cheerful mother.
Yeah,
effort.
he's always cheerful too.
Yeah.
But you know why Dr. Ken Anderson is always in a good mood? He wakes up every morning and he says to himself, "I did a hair transplant on John Cena."
It's true.
That's all he
true.
needs. And he's also just a good guy, so of course he's going to be in a good mood. I imagine he's the kind of guy, and we both know Dr. Anderson, where he's decided to take a fresh look at things that bother him and say, it's a thing, I'll deal with it. And he's chosen to look at the bright side of life.
Well, I will say what I've noticed over the years is, and not that he was like fucked up or out of shape before, but he really got himself into like tip-top condition.
Yeah.
I've seen that evolve over the last 5 years or so, maybe longer.
Yeah. It's been, well, I remember 2016 in Vegas, and I think he made the transformation about 4 or 5 years after that. So yeah, about 5 years ago, give or take.
Always got to one-up me, Joe.
Every time.
Guys, we have open lines. Phone number is 888-659-3727. But I would say generally I don't love having people in my studio. Those are 2 guys, Alan Bauman, Ken Anderson. Always have fun, really, when they're here.
To address Mike Pedroza 9218 in the chat room, Mike, he says, "Hold on, guys. I've been on PRP, dutasteride, mesotherapy, and it's done wonders for my hair." If you're talking about what I was saying with the treatments over the past 20 years, no one's been on PRP and said that they've been able to maintain or regrow hair on a Norwood, an advanced Norwood pattern. That was using those types of therapies alone.
Right.
You just said you're using dutasteride, a mesotherapy format. That doesn't count.
No, you're on a 5-alpha reductase inhibitor.
Yeah. I'm talking about just these regenerative medicine medical procedures like PRP, exosome, things like that. No one can claim that they or anyone they know over the past 20 years since this stuff has been around has maintained for the long term or regrown for the long term with just those particular modalities. No one.
And I will say, given the time frame that we're in right now, and knowing when the topical compounded medications started to come out, I don't really know anyone who hasn't switched from at least one topical to another, minimum. And I don't know too many people who've contacted us over the years who have just stayed on a topical 5-alpha reductase and have been able to maintain whatever growth they may have had for 5 or 6 years. I don't know anyone. I'm not saying it's not out there. I don't know. I don't know the world. So essentially, the only medication that I know of where people seem to have long, protracted, just fabulous results, while they do diminish over time, is an oral 5-alpha reductase inhibitor, and now maybe with a combination of a growth stimulant like low-dose oral minoxidil.
Yeah.
There's been no topicals out there in the history of my career. I'm talking about topical minoxidil, and that's a total Band-Aid. It has to be used with some 5-alpha reductase. Now, do we know if anybody who's using topical minoxidil combination with topical dutasteride or topical finasteride who are having long-term results? What you see online is people aren't sticking to the same brands. For some reason, they keep switching.
Yeah.
And I think that if they were content on these products, they would just continue in general.
So speaking of Dr. Bauman, he would be someone that would be good to talk to about that because he's had his topical formulations for over 10 years, maybe 15 years. And so his brand being what it is, he'd be a good person to talk to about that. That'd be interesting. And then I know that,
That's a good point, actually.
The topical that came out from Dr. Hassan, that was also well over 10 years ago that he started, and it wasn't this. What's the name of
Zion?
It wasn't Zion then. It was before that. It was being compounded locally at a pharmacy down the street from the clinic. I was there when he actually came up with his idea to do this, and we were seeing results early on. So there might be a history that could be documented there. We can't ask him. Well, we could, but he's retired now, so he doesn't have the current data. But yeah, there is a chance.
I don't think he likes me very much anymore after I told him to go fuck himself when he wanted to.
There is that.
When he got upset with me that I wouldn't help him get on the best hair transplant surgeons in the world list. And I'm like, that's not up to me, brother.
Yeah.
And then
it's a different Spencer.
He got, in my view, kind of hostile and almost a little insulting when he said to me, well, and again, this is not a direct quote, but it was something to the effect of, like, if I really cared for patients or something I'm like, what the fuck, brother? And I'm like, listen, I think it's time we separate.
Yeah.
I couldn't believe it. And I haven't heard from him since. But otherwise, he's a great guy.
Well, otherwise.
Yeah. I think I got to a point in my life, maybe it was 10 years ago, and you've known me all this time, Joe, where I decided, you know what? I'm not taking shit from anybody.
Mm-hmm.
When you try to make it in this world, especially when you're very young, you got to take shit. You just have to take shit from people.
Yeah. Yeah, you got to bite your lip.
And then I was just like, I'm maybe 45, I'd say. Maybe 45. I always want to I never wanted to have any conflict. I always wanted to just try to be kind to people, even if they were kind of assholes to me. And I just realized, look, these people have their own issues in life. There's a reason why they're acting the way that they're acting. And after a while, I'm like, fuck that.
Yeah.
You don't like it. This is how we're going to deal with it. We never have to talk again.
And that's the beautiful thing. You don't have to talk again.
No.
To people in general, when you tell them, or when you take that attitude.
I had a conversation with a guy, and very nice guy, I think, and he wants to apply to the IHRS. And then he started to ask me about, he wanted to have me speak to his marketing people. And I just put the brakes on him. Listen, brother, you're applying to an organization. If you don't understand what, these guys talk about ROI, what the ROI is before you apply to the IHRS, then you have no idea what we do. To me, when someone applies to the IHRS, they already understand that value. It's well beyond leads and all that nonsense. We're giving you an opportunity to leave an even greater mark in this world, to help more patients. It's not just about patients finding out about you. It's an opportunity for you to do your thing, which you're doing very well if you're accepted, at a larger scale, and to be recognized for that. That alone should make you happy. You say that you're in this field to help people? Here, we're shining a spotlight on you. Gives you the opportunity to leave a greater legacy. To me, that's enough. You're speechless, Joe.
I kind of am, yeah, because that was a great speech. You're absolutely right.
It's infuriating. It's like, and also it's so small-minded. And when you think about, here's the reality: we don't talk about this stuff, but we have maintained the lowest dues of these organizations, period, for a reason. We never want this to be a barrier to entry for anyone who is accepted, because we're looking for people who are great doctors. There's so few. Mm-hmm. So if you're accepted, this isn't even a thought. So currently it's like, I try to explain this out, our current membership obviously know this, but the average cost of the average punch that's being used in today's procedures is about $120.
If it's a good one.
If it's a good punch, yeah. There are a couple of punches used in each procedure. Add some gauze, whatever it is. Their disposables alone are going to cost him, it depends on the surgery, minimum a few $100s. Mm-hmm. Minimum, and that's low. I mean, I was just thinking when people ask me how much this is, I'm like, this is a third of the cost of a fucking punch that you're just going to throw away. And the reason I put that out there is for anyone who's like worried about like doctors who are rejected from the IHRS, and this is our platform, and who claim that, it's just a pay-per-play situation. I wish that it was. You know how much money we'd be making? Think about what you can make, Joe.
Oh, yeah. Oh, my God. Like, if I didn't have an actual review process that takes most clinics months to get through, it was just a matter of looking at a website and saying, okay, you're in. And what I could charge? Oh, my God.
Forget about looking at a website. You think these organizations look at websites in general? Dude, for fun, I used to send you our applications. It could be 100 in a month.
Oh, yeah.
It's like, if I just set up a what is it called, Shopify situation, I would be hearing that bell all day. Ka-ching,
by the way,
ka-ching.
I want to interrupt for just a few seconds here. We got a user in the chat room, abide.in934. Spencer, before we went live, I was telling you about my haircut. It's probably the best haircut I've had in the past 10 years. That's the guy.
Oh, really?
Benny the barber.
Listen, Benny, I got to tell you, I've known Joe for a long time. I've never seen him look this good.
I wouldn't go that far.
No. But the first thing that I said is like he looks really well rested and youthful. And then he told me he got the best haircut. And I can't really tell, honestly, except whatever you did to this guy, he looks great.
He slipped something in my water, and I slept like a baby that night. That's why. No, I
think it's the right balance of it's short but not too short as far as the sides are concerned. I mean, the top just lays real. I mean, it was just really well balanced.
I'm happy with it. So no longer am I going to my favorite Chinese barber,
Fuck her.
Chinese lady.
I'm just kidding.
Just freeballing it with the clippers. Benny's my boy. He's my guy. So thanks, Benny.
Yeah.
Now it's been a few days. It's a great haircut. I love it.
I'm doing my best to keep my 70s show ABBA situation happening.
ABBA called. They want their haircut back.
Yeah.
They want their hairstyle back.
1975 called. They want their haircut back and your bell bottoms that no one could see. Guys, the phone number is 888-659-3727. We have open lines if you want to call us. Otherwise,
Or we can take off.
Yeah, or we can take off. Joe's already excited about taking off. As soon as there's no calls on the line, Joe's stoked.
I'm tuned out.
Yeah.
Actually, I do have stuff to do. But no, I mean, if the people in the chat room, or not in the chat room, but are listening, want us to stick around, give us a call. If not, that's fine. We can take off. We can leave.
But I do want to make it clear to physicians who are applying and things are changing in the IHRS. Just please don't have your marketing people contact us.
It's the worst.
Well, this is an organization. I want to speak to you. I want to know about your staff through you. I want to know about your philosophy through you.
Mm-hmm.
And even after that initial consultation, in quotes, nothing goes through your marketing team. Because if you just consider what we're doing marketing, don't apply.
Yeah. Do us a favor. Go away.
Yeah, just go away. And I hope that doesn't sound obnoxious. It probably does to some doctors out there because they don't fully understand what I do or what you do. But I wouldn't be going into my 25th year of this organization if we weren't doing the right thing. Let's put it that way.
Yeah.
Jesus Christ, 25. It's going to be the 25th anniversary of the IHRS.
That's crazy.
Think about that. And when we started, everyone wanted to destroy it. I mean, everyone. The ISHRS, in my view, it's people who thought they were competing with us. It was the most insane launch of anything in the history of anything, I think. I've never seen such resistance.
Get that shampoo thing going again, Joseph. Robert Hellner. No. Why? I don't sell stuff. It is a good shampoo, though. Grow and D.
Let's call it a night. There's no phone calls. So Joe's Instagram is Joe Tillman Official. That's at Joe Tillman Official.
There you go.
I don't even know why you have to say at anymore, but, you know.
For some people.
It's like www. Yeah.
www. http : https, sorry.
We really are the best, Rob. I'm just kidding. I'm not kidding.
Thanks, Rob.
I'm just kidding. I'm not kidding. And Jerry Cooley is the man. He's a good guy. And I will say one thing about Jerry Cooley, because I speak so poorly about these political organizations. When he was the president of the ISHRS, and I was dealing with a really bad guy in this industry who I ended up having to sue and essentially prevailed. At the time, it was the largest online defamation win in Los Angeles County. He wrote a letter as the president, as the president of that organization, the trade organization, the ISHRS, essentially stating that, you know, who I am, my position in the field, his thoughts about what's happening with this physician who is defaming me. And that weighed very heavily on this case. And I really,
Sure did.
I really, really appreciated it. And it was funny. He offered it. I don't even remember asking him.
That's Jerry Cooley for you. I had a nice talk with him today, actually.
He was just pissed that there was a physician that was part of the organization that he's the president of that would be willing to go out there and defame me the way that this guy did.
Yeah.
That was some vicious stuff. I haven't never sued anybody for this over the years, and there's people that I could have. This guy I had to take out, and it was a fucking pleasure.
It's satisfying.
He had a breakdown.
Yeah. Did he close up shop?
He had to close up shop.
Yeah. Not because of the financial hit. It was the psychotic hit that he took.
Yes. I mean, the financial hit was not great because it really affected his credit and everything else. And it was something that it was out there online. But just that was made public, he could no longer practice.
Yeah.
What a ruthless industry this is. I tell these young guys who are getting into it, man, you have no idea. You have no idea.
And if it's any better for them, it's because you paved the way.
Oh, well, thank you.
You made it a bit smoother.
Thank you for saying that. God, this is such a fucked up industry. Guys, I am at Spencer Kobren on Instagram. My name. That's my handle everywhere.
It's not Kobren.
Yeah, it's K-O-B. It's
K-O-B-E-R-N.
Yeah, it's K-O-B-R-E-N. Spencer Kobren. K-O-B-R-E-N. I threw up some TikToks. I kind of stopped that. I just don't like being on the app. I have to tell you the truth.
I tell you, the one thing I like about YouTube or about TikTok is it's great for finding new music when I'm in bed and I can't sleep. I will doom scroll till I fall asleep, but it's listening to good music. So
interesting.
I like TikTok. Yeah.
Now, is it good music with 20-something-year-olds bouncing around, or is it just good music?
No, it's just good music. I mean, there's some really good music there. Independents that have no audience whatsoever. And I found some that have just started and they've put out some tunes that are just ungodly good, like so catchy and just great little pop tunes. And some are, heavy rock, and some are just really stuff you can't even classify. It's just so unique.
You know what I listen to when I go to sleep?
It's really cool.
Right now I'm listening to a biography of Churchill. What's wrong with me?
There could be worse things. Who's narrating?
Some English guy.
Some English guy. So it's not like Lawrence Fishburne was recruited to do like sometimes celebrities will be doing some of these documentaries.
No.
Okay.
Yeah, I mean, I think it's Sly Stallone. Wouldn't that be awesome? I don't know, some generic guy.
Okay.
Yeah.
All right.
Yeah, I understand he's gonna be narrating for Audible the Harry Potter books.
That's hilarious.
That's where my mind goes, man. All right, guys, listen, until next time, this is a fun show. Be strong. God bless. Thank you guys so much for listening. Have a great weekend. And what's the right button to push? God, my mind
We'll see you next week.
Blank. See you next week.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exit.